Hi, today we'd like to come back on the topic of cervical intraepithelial neoplasia, or CIN. It's a long medical word, and the treatment that we offer here at Antai Hospital that is rather unique and highly effective in the prevention of cancer progression. So CIN is a condition where basically there are new abnormal cells that are growing on the surface of the cervix. Usually we will only catch this if you go for regular cervical screening, where we do some cervical biopsy, colposcopy, and also pap smear. This is how we diagnose the CIN-1. So CIN is graded depending on risk factor, CIN-1 being the lowest risk, CIN-2 and 3 being high risk intraepithelial neoplasia. CIN-2 and CIN-3 means the condition has progressed into severe state and has a high risk of progressing into cancer or invasive cancer of the cervix, and it can also progress into other parts of the reproductive system. So at Antai Hospital, we urge our patients to go for regular screening, and if you have been diagnosed with CIN-1, then you must receive treatment at the soonest time. Many hospitals won't even administer treatment at CIN-1 because they want to observe for a time being, because sometimes CIN-1 can turn back and the patient can recover on her own. However, we don't want to take that risk because cervical cancer can be developed if there's no action taken at the correct time. So we do urge our patients to go for regular screening, and if you have been diagnosed, receive treatment as soon as you can. So how can you develop CIN-1 is that it's usually due to a contraction of HPV infection, especially high risk HPV infection 16, 18 and 33, and several others as well. So if you are sexually active, it's possible that you could have a risk of this cervical intraepithelial neoplasia. But if you do practice safe sex and have regular partners, you have nothing to worry about, because most women do contract HPV. Low risk HPV is the most common form of this infection, and even if some women develop high-risk HPV infection, they do tend to recover on their own because your immune system does tend to kick in and flush out this infection. But some women do develop into CIN-1, CIN-2, CIN-3 due to specific factors. For example, age, you could be slightly older, and then you could be having a high-stress lifestyle where you consume excessive alcohol, excessive smoking, and some very not so healthy lifestyles. It can increase the chances of these CIN-1 to develop into much more severe stages. Even patients who have an immunosuppression because of their lifestyle, your immune system is suppressed, could be some medication that you're on, or could be the bad habits that you have in your life. It can trigger this CIN-1 to progress on its own, and it's very difficult to recover on your own. You need some treatment here. So conventional treatment is that they like to use surgical excision, where they just remove or excise the infected regions. However, it's very easy to go into overtreatment at this area if you go for this kind of surgical excision, where they will do scraping, conization, and sometimes even recommend partial hysterectomy, which is rather invasive and destructive. And sometimes it's not effective as well, because after the treatment, you see that the infection tends to come back within a few months again, and you need to go for another excision as well. Alternatives include ablation techniques, where they use cryotherapy or even heat ablation to just freeze the abnormal cells or even heat the abnormal cells, but these tend to be ineffective as well, because you don't know where exactly the extent of the treatment has gone, whether or not the patient will fully recover. Antai Hospital now offers a highly effective alternative treatment that does not excise any tissue and uses a chemical ablation technique that can reverse this infection and guarantee that this cancer progression will stop, and you can have normal cells to replenish as well. This medication that we use, this chemical medication, is a proprietary medication invented by Antai Hospital that we know as Antay, and it's highly effective in treating your cervical intraepithelial neoplasia. This treatment is only effective for HPV infections, CIN-1 and CIN-2. Any stage after CIN-2, this treatment is not effective, and at that stage you might need cancer prevention treatment to actually stop the cancer progression. So time is of the essence. Once you do get diagnosed, even a basic HPV infection, you do need to seek immediate treatment, and also general checking up with your doctor just to make sure that there's no cancer progression or no cancer risk. So do get in touch with us via the website to set up a consultation to discuss how we can help you treat your cervical abnormalities to prevent cervical cancer, as it is increasingly common that women develop this infection. CIN-I and CIN-II is incredibly treatable nowadays, especially at Antai Hospital. So do take the opportunity to go for regular screening and also come for treatment if you do in fact have this diagnosis. Get in touch via the website and also leave me a feedback down below.